And it's thicker than the appropriations bill, which means it's even better than the appropriations bill. Listen, there are so many people to thank for the progress that we're making here. I want to thank the legislators who have worked tirelessly with my administration to make this moment possible. In particular, the chairs of the committees in the Senate, Senator Ann Cummings, Chair of Finance, from Washington County, Senator Claire Ayer, Chair of the Health and Welfare Committee from Madison County, and Representative Mike Fisher also hails from Madison County and chairs the committee in the House that did so much work on this bill, as well as all the individual legislators that have really evolved with us in creating this moment for Vermont. I also want to acknowledge the Green Mountain Healthcare Board members that are here, that are working hard to build the first single-payer healthcare system in America, where healthcare is a right and not a privilege, where healthcare follows the individual, isn't required by the employer, and where we spend our healthcare dollars making people healthy again, not on waste, inefficiency, and a payment system that's going to drown us. So thank you so much, first of all, to our chair, and Anya Rader Wallach. Where's Anya? Thank you. Don't jump. In fact, if you get away from that window. And to Dr. Karen Hine for your great work. And is Alan Ramsey here, Dr. Ramsey? Thank you so much for joining us. Let's give these three a hand. They've got to Andrea Cohen and the Vermont Business of Social Responsibility. Is Andrea here? Yes. Come on over. Come on, we need you in the crowd. They have been a huge support for universal access and for our healthcare reform efforts, and we're proud of you. I want to thank my own Robin Lunge from our administration. I don't think this bill would do a thing. Paul Burns and Cassandra Geekus from VPIRG. Thank you, Cassandra. You've done great work on this bill. We're very proud of you. I want to give special thanks to Peter Sterling for the Vermont Campaign for Healthcare Security and to Rebecca Davidson and Linda Robley, who are small business owners. Raven Mark Design and Communications have been really at the forefront of saying, as business owners, this has got to happen. And thank you for your great work. We're going to hear from you in a minute, so we'll put you on. We're going to hold the applause. To Mary Eversole from Vermont Insurance Association agents. Mary, where are you?
Right here.
Thank you. Thanks for all your help and your support, and we really appreciate your participation in this effort. Listen, here's where the rubber meets the road, and we'll talk a little bit about where we are. The biggest challenge that we face for growing jobs and economic opportunities in Vermont is to ensure that we have affordable universal health care. And we all know how the math works. If by 2015 we don't find ways to control costs, we will be spending $2,500 a year out of the pockets of every single living Vermonter every single year that we're not spending today. For a family of four, that's $10,000 that will be spent every year going forward, and that number will continue to rise. Now, I happen to be elected governor at a time when Vermonters on average are making the same money they were making a decade ago. And we're working day and night to try to turn that trend. But I can tell you that if Vermont can get health care right, which I know we can, where it's universal, where it's publicly supported, where we all pay and we all gain, and most importantly, where we contain the rising cost and come out with better outcomes, healthier Vermonters, better quality of life, spending less money than we otherwise would, we will grow jobs, economic opportunities, and be the envy of the other 49 states. Now, some might ask, well, this bill you're signing today, what does it do? It takes the Affordable Care Act as passed by President Obama in Congress and takes us a step closer to the goals that I just outlined. How does it do that? It creates, on the internet, one exchange where everybody can shop for health insurance. Second, it draws down about $400 million to help struggling Vermonters pay for ever-rising insurance costs and to help businesses pay for ever-rising insurance costs. Third, it puts us on the road to divorcing job from healthcare. We do not believe that it is in the best interest of job growth to make it the responsibility of employers to pay for the ever-rising cost of health insurance. This bill will give us the federal subsidies that will make many small businesses in Vermont, and we know we're a small business state, look at the numbers and often conclude that they and their employees will be better off by letting their employees go shop in the exchange for health insurance, not required by the employer. That helps us move towards one single pool, one single pipeline for health insurance. So it's a great accomplishment. We're having more courage in other states. When governors around the country see me, they say, are you really requiring right away small business to be part of this effort? We say, with great pride, we are, because it's going to draw down all kinds of federal dollars, $400 million that we desperately need in Vermont to pay for ever-rising cost, and we believe it's going to be a help in moving to a single-payer healthcare system. So it's a big moment. I think the legislature's done extraordinary work. I want to give a few folks an opportunity to say a few words. Robin, take it away.
All right. So I think the governor's pretty much covered it in terms of the health insurance parts of the bill. This bill completes the work that we started in Act 48 on the Vermont Health Benefit Exchange and brings Vermont's insurance law into compliance with the federal law, as well as moves forward with building our exchange. In addition, other parts of the bill that I think are also important but got a lot less attention that are worth mentioning are that the bill ensures that prescription drug coverage is affordable for folks by prohibiting some excessive pricing around cost sharing for drugs. I think that's a very important, smaller improvement in our insurance laws. In addition, it takes some moderate steps to move us towards medical malpractice reform by creating some additional disincentives to filing lawsuits which aren't fully vetted. So that's another very important part of the bill. There's some other more detailed wonky stuff that I won't mention, but I'm a wonky girl, so as you all know. I'm very proud to be here today, and I think we've taken a very important step forward. Thank you.
And Rebecca Davidson, if you don't mind saying a few words, we know you've worked hard on this effort.
She has to come with me.
All right, that's fair enough. Come on, it's a team effort. Say anything you wish. We're glad
we're here too. As a small business, we think this is a step toward building economic prosperity in Vermont, and that it will allow our small business to grow, which we have not been able to do because of healthcare costs. It's been pretty prohibitive, and we've also, we estimate we spend between $150,000 and $50,000 a year, and we get nothing back for it because the premiums are so high that it would be catastrophic if anything happened, but we always, the health insurance that we have is not, that $150,000 isn't doing us any good.
That's actually over the course of the last 14 years that we've spent that much money.
Right.
It would be really nice if we had that kind of money to put back into our business. And we really believe strongly that if you have a business, if you have employees, you take care of them. And up till now, we haven't really been able to afford the health insurance for our employees. So this is an incredible step in the right direction for us as a small business. It helps us close the loop a little bit to take some of that investment and put it back into our business and take care of the people that we want to take care of that work for us.
Thank you so much. Thank you very much. Now we'll hear from the chair of the Health and Welfare Committee. We don't call it anymore, but back when I was here.
Healthcare Committee.
Thank you. Healthcare.
Thank you, Governor. It's great to be here and great to be standing with such a great team. I just have to mention a few other people to thank. I want to thank Legislative Council. We couldn't do it without Legislative Council and Joint Fiscal. I also want to recognize citizen advocates in the room who have put a ton of energy into supporting this effort. And we often sort of minimize citizen advocates. We often sort of say, you know, in patting ourselves on the back, we don't recognize how important. We couldn't do it without citizens stepping up and holding our feet to the fire and saying, you have to move. So I want to thank Walt, who I see. Let me just tell you, Walt has been with us day after day after day for 2 years or something. So thank you. In the last couple of weeks, since I've been let loose from this building, I've been speaking to people, and I hear a similar theme. I hear great business people, similar to the business person we just heard, express frustration about how hard it is to provide good care to their employees, living year after year with double-digit increases in their premiums, recognizing that the quality of the coverage that they're buying their employees is worse and worse and worse year after year. And similar to that, I hear from Vermonters who, despite the fact that they have insurance, can't afford to get the care that they need because they can't afford the copays and the deductibles. So this is a really important step. It moves us towards a better affordability for healthcare. It moves us towards a system where we take care of people. We help people get the care that they need so that they can live the best lives that they can.
Thank you so much. And Mike Fisher mentioning, well, other advocates reminds me whenever we do anything on healthcare I know we're all thinking about Dr. Deb Richter and Terry at this moment. We're dealing with the most unspeakably horrid thing that any one of the parents can imagine, which is the death of their son who died in a motorcycle accident in Florida a week ago. And I know that we're all sending Deb and Terry all the love and support that we can possibly give during this incredibly difficult time. Commissioners, do you want to add anything? No? Any other anyone else from the team? No?
You know, actually, you know, I would say one second. It's important that as we have this conversation that we separate the myths from the facts, and I think that's what we're trying to do here today, and it's really important. And I think the other thing is to make it clear that what this shows, this pile of paper, and it's a pretty complicated piece of legislation, shows that if you're persistent and you're intelligent, you can overcome complexity and challenges. And that's what the Shumlin administration is doing here. And I think it is very important. I've heard from business people who email me and say all the things, all the sort of talking points that the opponents tell them to say. And I write back and I say, well, here's what's really in the bill. And they write back and say, well, gee, I had no idea that that's what it did. Thanks a lot. Let's get together and talk about it some more. So I think being persistent and being smart about what we're trying to do is going to help us overcome all the challenges and all the complexities involved in healthcare reform, and frankly, overcome the opposition as well. So I really appreciate it. Thanks.
I just want to echo what Senator Polina said. You know, a little under 2 years ago, there was an election, and you staked out. You were not shy in your position around healthcare, and I think I wasn't alone probably in wondering if we would really get there. And there's been, we've heard from folks who made the work possible, from the technicians to messaging experts, but there's, I think we owe you a real debt of gratitude for your political leadership and not flinching for 1 minute, and we have a long way to go, but thank you very much for
So let's be clear, this is a small step and a much bigger goal, but let's sign it, come on. So everybody around, come on, this is your chance. Anya, do you let your people get in photo ops, or is that not allowed? Yes. Come on, bring the docs in. They won't go without you. Can't say I blame them. Come on, Karen. Okay, you ready?
Yes.
Here we go, I think. Five, 16, 12, we make a little piece of history together. Congratulations. go to, first of all, I think we're going to give a pen to Rebecca and Linda to scale. And I got to say, there's someone here that never shows up at bill signings. I'm going to embarrass him because he kind of likes to hide under the radar, but he's done more for universal access than many in Vermont. And it's Peter and Colby Sparrow. And I didn't get a chance to read this whole bill last night. But thank you so much for joining this team. Way to go.